What I'm going to be doing is talking to you about some research, a research project on early indicators. If you could see that, it would say early indicators of concern in residential and nursing homes for older people. I'm going to be talking to you about the research and what it means, and then Nolene is going to be talking to you about the work that we're doing in Cumbria to implement some of these findings locally to improve the care of people in care homes, nursing homes, and we're including hospital wards in our work as well, aren't we, Nolene? So what I want to talk to you about here is as I say, early indicators of concern. This presentation is based on a project that identified early indicators of concern in residential nursing homes for older people. But the findings, although it's about older people, I do believe that the findings are transferable to other groups. There's a guide that's been produced following some very detailed research into known cases of where abuse took place in residential services and nursing homes for older people. Analysis of these examples produced a series of indicators. And where there's a pattern of indicators or a cluster of these indicators in a service, it can be said that the people receiving the service are at risk of abuse. These are early warnings, they're early indicators, and early warnings that there might be a weakness or a significant weakness in a service which may place people at risk. The existence of a number or a pattern of these indicators that we're going to look at in a minute have been found to be associated with abuse and neglect and harm. Importantly, this is evidence-based research. So what we're seeing here is what happens in real cases, things that surround real cases of abuse and neglect in care homes and nursing homes, things that can actually identify when things are going wrong at an earlier stage. And I think it's important now, it's important always to be aware of this kind of work, because what we do certainly in my bit of the work, where I manage the safeguarding team in Cumbria, and what we're doing along with social work teams is reacting all of the time to situations of abuse and neglect. I think if we do this, and we do this right, and we do it properly, we can be proactive rather than always reacting to abuse and neglect. That's why I think it's an important piece of work. It's also important because there's a very poor perception, I think we would all agree, a very poor public perception of care homes. And that's been underlined by stuff we've seen on the television, very poor perception. And we come away with the idea that the care homes are bad places to be and often dangerous places to be. And sadly, that's underlined, I think, at the moment by a poll that's been recently published in Community Care. This actually underlines this poor public perception of care and care homes. And it reveals that older people, a group of 2,500 older people were asked about their views of care and care homes. And it revealed that they associate care and care homes more with abuse and neglect than with safety and real care. And that's quite a sobering thought, I think. And I think that if we can get this piece of work right in Cumbria, where we're identifying things early before abuse has happened, then we can also, I think, improve the image. Because what we're going to be doing is working with and alongside and in partnership with providers of care for individuals. The work that was done identified that health and social care practitioners who visit services like care homes, nursing homes and hospital wards as part of their professional role do notice signs or indicators that something's not quite right, indicators that's causing them to be concerned about what they're seeing. And often those indicators can be associated with abuse and neglect. I think then these practitioners, healthcare practitioners, social care practitioners, are very well placed to identify and raise concerns and take action before the situation gets much worse, and therefore hopefully to prevent the onset of abuse and neglect, the onset of people getting hurt and harmed. Key themes were identified in this research that's based on real cases and real situations. The key themes have been identified which highlight aspects of services which contribute to the risk of abuse and neglect to individuals using those services. In addition to identifying individual indicators of concern. They also were able to collect them under 6 main headings. So the 6 main themes really are things to look out for, to ask questions about, to identify issues or worries as you're visiting services. These key themes, the ones that we're going to look at in a bit more detail, you'll need your handouts to look at them, provide, I think, really important information about key aspects of service design and delivery that increase the risk of abuse and neglect for not just older people, but for people who are using those services. The first cluster is really around concerns about the leadership and management of the establishment that you're visiting, you're walking into, that you're involved with. And it would be evidence or things that you're seeing that indicate to you that there's a lack of leadership by the managers. For example, managers who don't make decisions or set priorities for the establishment. For example, a manager who's unable to make sure that plans are put into action. Managers who know what outcomes should be delivered, but appear unable to organise the service to actually deliver these outcomes for the individuals that they're caring for. They appear unable to make things happen in their establishment. Managers, and we've come across those, I can see social workers in this room who will recognise some of these things. Managers who appear to be totally unaware that there are problems within their establishment. And it could be where managers appear unable to make sure that actions agreed at reviews and other sorts of meetings, like, for example, safeguarding meetings, seem unable to ensure that those actions are carried out. These are concerns that should worry you in relation to the management and leadership style. As should be an establishment where the manager appears to be very controlling or is not actually role modelling good practice for his or her staff. So that they're not directly involved in care of residents. It could be that what you're seeing is a high turnover of managers in establishment, which should cause you some concern about the way in which the establishment is run. The next cluster of early indicators are really around the concerns about staff skills, knowledge and practice. And this would be where you're visiting an establishment, you're visiting someone there, or you're doing work in an establishment, and you become aware that, or you think there's evidence that staff appear to lack the information, knowledge and skills that they need to support the people that are living there, particularly those who might have dementia. And you're identifying that actually skills don't really understand the needs of people who have dementia. Where staff appear challenged by some residents' behaviour, shall we say, and don't really know how to respond to that effectively. Where staff don't manage individuals' behaviour in a safe, professional or dignified way. For example, it could be that the people are sent to their rooms because they've transgressed some rule or other. Or medication is used inappropriately or as a first resort. I can think of establishments sadly still existing today where medication can be used almost as a chemical cosh to keep people quiet. It could be where members of staff actually perceive the behaviours and the needs of the residents as a problem, that it gets in the way of them doing their job, where they blame residents' confusion and dementia for their difficulties, where, for example, members of staff are controlling behaviour in inappropriate manners, where staff treat residents roughly or forcefully, where staff ignore the needs of residents, where staff shout at residents and are impatient. And I think, for me, I could go on and on with this, but I think one of the baselines for me when I'm talking to people about abuse and neglect, particularly in care homes and nursing homes, is one of the things to be aware of as a real concern is where you come out and you feel that place is being run for the benefit of the people that work there, rather than for the benefit of the people who are living there, then that could be a cause for concern. And that's the sort of thing that we're talking about here. The next group of concerns or indicators are around the behaviours and well-being of the individuals who are living there, the residents themselves. And it could be that one or more of the residents show sign of injury through lack of care and attention, that they appear to be frightened or show signs of fear, that the behaviours have changed, that someone you know very well suddenly is behaving in a very different manner. where actually moods or psychological presentation has changed in individuals, that they actually don't progress or improve in ways that the way that you think they ought to. And finally, that there's an overall atmosphere in the establishment that's flat and gloomy and, let's say, miserable. Okay. The next group, the fourth group, would be around concerns that the service itself might be isolating itself and isolating the people that are living there. It would be where managers and staff don't respond to advice or guidance from practitioners and families who visit the service when you identify things that could be done better, but they don't take any notice of you, where the service doesn't appear to be reporting concerns or serious incidents to families, external practitioners or agencies. People often talk to me as a safeguarding manager about, for example, the large number of alerts that might be coming in from a particular establishment, and that's often taken as an indicator that something might be going wrong. For me, I will say to you that the establishments that cause me the greatest concern are those that we never hear from, because those are the ones that are isolating themselves, not identifying things, not reporting things. The ones that report are doing a good job, in my view. The next group, the fifth group of indicators are around the way in which services are planned and delivered. And it will be that there's evidence, you're seeing evidence that there's a lack of clarity about the purpose and nature of the service. And again, you saw that in Winterbourne View, where the service doesn't appear able to deliver the service that's needed or support the individuals that they're supposed to be supporting. Where decisions about where residents are placed are influenced by a lack of suitable alternatives rather than this is where this individual's needs will be met and where this individual will flourish. Where the service is accepting residents whose needs they know they can't meet or they appear to be unable to meet. And finally, where sometimes you become aware that the layout of the building itself doesn't easily allow residents to socialise with each other or with anyone else in any sort of privacy. Now, again, I say, this organisation appears to be running for the benefit of the people who work there rather than for the benefit of the people who live there. Finally, there's a group of concerns and indicators around the basic care that people are receiving and the environment in which they're receiving it. And these are concerns where the service is not providing a safe environment for the individuals that they're looking after. Where there's a lack of activities or social opportunities for the people living there, where the people don't have access to things such as their own property, their own clothing, and maybe even their own money. And where equipment perhaps is not being used at all to help individuals, or is being used incorrectly. Or significantly, I think, where the home is dirty and shows signs of poor hygiene. These are all indicators of concerns about the general care and well-being of individuals. Things like equipment and furniture is dirty or it's broken. Staff aren't using wheelchairs safely or correctly, aren't using other sorts of equipment safely or correctly. And the quality of the environment in the establishment has deteriorated quite noticeably over the months. The next one is a format that we're going to adopt locally for actually recording what you're seeing. So when practitioners, adults, when social care and healthcare practitioners are going into establishments, they're seeing things that worry them. This is encouraging people just to write them down and think about what it is that's causing you a concern. But you'll see the 6 areas or themes are sort of spread out on the sheet, and it gives you the opportunity just to record stuff under those headings that is causing you concern. And just you stop and think about it, analyse it, try and work out what's going on. If you're seeing a cluster of things, then you need to be talking to people about it. You need to be reporting that as a concern. So to repeat, this guide and this tool that we will be hoping that the board will adopt and will be sort of circulating across all agencies will be issued to practitioners in health and social care for them to use. It will be issued to families if they want it, so that they can use it when they're choosing a home for a loved one. It can be used for anybody who's visiting and in care homes, nursing homes and hospital wards. The guide This tool and the guide has been developed following, as I said, detailed research into known cases. So it's evidence-based, and it's true. We know that these sorts of things indicate that there's something really seriously going wrong. And I said, whether there's a pattern or a cluster, that's when we should be starting reporting our concerns to the relevant agencies. What we're saying is you record your worries, you reflect upon them, and then you talk to someone, you act. So you record, reflect, and act is the message from this. The patterns of concerns aren't proof that abuse has happened, but they are indicators that it could happen if we don't intervene in a timely manner. For me, it describes every serious case review report you will ever read, okay? And this is, it's an indicator of why it's important to record, reflect, and then take action, because you can't rely on the fact that somebody else might do this, okay? Just read this out to you, that everybody, somebody, and nobody. It's a little tale about everybody, somebody, and nobody. And there was an important job to be done, and that was somebody had seen something that was worrying them, and somebody needed to report it. Everybody was sure that somebody would do it, and anybody could have done it, but nobody did it. Somebody got angry about that because it was everybody's job to do it. Safeguarding is everybody's business. Everybody thought that anybody could do it, but nobody realised that everybody wouldn't do it. It ended up that everybody blamed somebody when nobody did what anybody could have done. As I said, this is the story of every serious case review ever written, I believe. And to quote Margaret from this morning, it's people who keep people safe. And it's up to us to actually report and act, is to record, reflect, and take action on the concerns that we are identifying and seeing. And finally, you can't see it, but it does repeat, report, reflect, and act to prevent the abuse and neglect of adults at risk in care homes, nursing homes, and hospital settings. And again, to quote Margaret, again from this morning, and Seamus Heaney, we have to mention that he actually wrote it, please do not fail them by disregard. Thank you. And also to quote Mr. Long, listen to what people are saying. Thank you. I'm going to hand over to Nolene now, and she'll talk to you about what we're doing in Cumbria to actually implement this work.
Irene's talked a little bit about the research, and I think what's important now is to put it into context and tell you a little bit about the work that we're doing in Cumbria at the minute to try and put something in place that will prevent us having a serious incident or a Cumbria Winterbourne view. I now work for Cumbria CCG, which is the commissioning organisation, and that means that we are responsible for the care that's delivered anywhere where we pay for services, if that makes sense. So we do have a real strong interest in the quality of care that's given for everybody in the population in Cumbria. I know this is based on care homes because this is where the work started, but what I would like to say is we know that it's not just care homes in the independent sector. We've got to monitor every establishment where care is delivered. Just because somewhere's an NHS institution, it doesn't mean that it doesn't need scrutiny or it's above reproach. We only have to look at the Francis report to see that some places within the NHS aren't safe places for people to be. And as a nurse, I find that incredibly difficult, that we've got to think that people who are in the nursing profession aren't always given the care that we would expect them to be. The Francis report was sad reading for everybody, I think. So, why did we need something in Cumbria? As Irene said, every serious case review comes up with the same things. Everybody knew something was wrong. Everybody thought something should be done about it, but nobody coordinated that and brought everything together. And some of the big things that you see on the TV, particularly around children's services, I could write a serious case review without even reading anything, because it'll be poor communication and everybody thinking it was somebody else's job. And that probably sums up every single serious case review, as Irene's just said. So there's also a need to look at what is intelligence, because we have loads of data, we count loads of things, and it doesn't tell us anything. What tells us what we need to know is that softer intelligence. The people who are thinking, this isn't quite right, I can't put it into words, but there's something that just doesn't feel like it's working here. And this is about dignity, and it's not about inspections, ticking boxes, making sure we meet specific criteria, because we're good at that. What it's about is, what does it feel like? Would I want to be in the position that person's in? And that's what we need to be thinking about, because some of the areas where there's been major problems, and I'm talking about acute hospitals at the minute, are the places that were really high performers on paper. The Mid-Staffs Hospital, which was criticised in the Francis report, was actually a high-performing organisation if you looked at the paper criteria. What we decided was that we needed to look at something. We weren't quite sure what it was. There'd been a couple of serious incidents in the care home sector in North Cumbria, and what we really wanted to do was move away from the situation where we had to have a serious safeguarding incident before anything was done. So we set off in Eden locality and piloted a way of gathering information. And this was basically about getting everybody around the table and saying, is there anything that's worrying us about this particular care setting? And we did have an amazing template where you counted the number of falls, number of UTIs, various different criteria. It didn't really tell us anything. What did tell us, what we wanted to know, was that conversation round the table, having everybody together. And it really, when you say, oh, have you noticed this? And other people say, oh yeah, it starts that conversation and it gets underneath all the tick boxes and it moves away from, we've had 27 falls and 2 UTIs, to this doesn't feel quite right, this isn't quite working. So, as I said, the work started in Eden and then it rolled out into the other localities. I don't know if you're aware, we work in 6 localities across Cumbria. What happened then was each locality started to put their own system in place, and each locality had a slightly different way of working, which is fine because you do need things to be developed to suit the local population. But also we thought maybe this needs to be standardised a bit, maybe we need to bring things together. And that's where, sort of coincidentally, but it was actually perfect planning, Irene did a presentation on the whole work to the Adult Safeguarding Board, and we thought, yeah, that's the sort of thing we've been looking for. That's what we need. And we had a traffic light system, which was basically, if people had lots of concerns, this was red and we needed to intervene. If there was a low level of concern, that was about getting together with the providers and having the conversation. Do we need to do something together? Because it is important that we're not seen as sitting in the CCG or adult social care with a big stick and smacking people when it's not quite working. It's about getting those conversations together. Can we help? Can we support? Is there something we can put in from an education point of view? Is there something we can do around workforce planning? Just that more of a helpful approach rather than a sort of overseeing, authoritarian approach. And in a lot of the cases, people were really, really pleased with how things were working in the care homes. And we've also had a lot of areas of good practice that have been discussed. So I think it's really important that we put that out there. It's not just looking for issues, it's sharing what's good as well and getting that out across the independent sector. So we've got a plan. We're going to hopefully use the system that Irene's just described, put that alongside the data, because it is quite important if you're addressing a problem to have some hard facts that underlie the soft intelligence. The two can go hand in hand together. And it is good that we have a slightly different approach in each locality, because people do work in different ways and one size doesn't fit all the time. That's virtually where we are. We're starting to put things in place. We're hoping that what it'll do is create a supportive environment where we can work together as commissioners and providers to get things right. This was a clip that was taken from an Alan Bennett play called Talking Heads, and it was called Waiting for the Telegram. And it was about a lady who was telling the story of when she was a young girl and she was waiting for a soldier to come back from the war. And what she got instead was a telegram. And what she regretted most was that they'd never made love, because she was a good person. She was a good girl, and that wasn't what you did. And she'd never had a chance to tell that story because there wasn't anybody to listen. And she's laying in bed and she's explaining that he didn't like tangerine and this isn't her dress and she wouldn't have liked to have worn it, but it's what they've put it in today. But why worry about a dress when you've had somebody else's teeth one day this week? And did people not realise that she'd had a love and she'd had a life?